Hello everybody, I am Dr. Duke and welcome to my presentation today. Look, if you love to run, take boot camp classes, do any kind of fitness and cycling, then today's presentation is for you because we're going to go over the ITBAND, the iliotibial band. What? You've never heard of the iliotibial band? If you like to stay fit, trust me, one day, you will. It is the #1 injury that comes into my office and sidelines athletes across the country and throughout the world. Here's the deal. The IT band attaches your hip to your knee. That's it. So when you run, it's short and compressed. When you cycle, it's short and compressed. And when you sit in the office, guess what? It's short, it's compressed. And then when someone says, hey, your glutes are weak and you need to strengthen them, and they give you that band, and then you start doing like the sidestepping exercises, that just jacks it up and makes it 100% worse. What happens is that they call it IT band syndrome because it'll cause a stress fracture to the sacrum or the pelvis. It makes you run tilted, or makes you bike tilted, makes you exercise tilted, lift weights tilted. It just throws your whole axis off. And I've seen the most injuries I've ever had from people who have had chronic IT band syndrome. Stress fractures to the hip, stress fractures to the femur. Eventually they get some kind of bursitis to the hip, maybe bursitis to the side of their knee, patella tendonitis. I mean, I've even seen stress fractures down to the shin and the foot because people are just running with it. They think like it's okay to kind of move. So what we're going to do today is I'm going to review with you a mobility and then a flexibility routine that you do before you run or spin or take your class. You heard me. It takes like 5 to 7 minutes. That's it. Today it's going to take me longer because I'm going to review that, and I'm going to also get into greater stretches you can do after you're done with your fitness classes, and then some self-treatment ideas for you. Whew, here we go. So first, I want you to mobilize. And what I mean by that, lie on your back, hips up, and just start to twist. And what'll happen, these movements are only about 5 or 10 seconds each. Go ahead and cross your leg and try to open up your hip socket. That'll make the synovial fluid within the hip socket kind of move around. That's the gel that everyone's injecting to their kneecaps. You know who you are. They call it synovial fluid, hyaluronic acid, gel injections. You have it in your body, it just gets stuck, and you need that lubricant to move freely. This is a movement which I really like for the hips. You kind of put your hands between your knees, and you open and close like a windshield wiper. And that's great for kind of preventing hip impingement syndrome. Again, these are quick movements. These are not things that you spend like a half hour on. I want you to do it before you run. Go ahead and take your leg and just pull it over. And then sometimes you'll get a nice release to your back. That's what I'm talking about. An interarticular adhesion. Something that kind of locks up your pelvis and makes you run or move funny. That's why people come into my practice. We do joint manipulation. So this is a nice way that you can almost do it yourself. Then go ahead, get your legs up like this, cross one knee over the other, and just move it to the side. And then move it to the other side. I just got another release a little higher. You see, when those adhesions stay within the spine, that pop or click that you hear, that's gas. Carbon, oxygen, nitrogen, it's like cracking your knuckle. And when you get it to release, it's the greatest feeling ever. You're just like, it feels so good. And then just keep on moving back and forth. Now look, these are movement prep exercises. So go ahead, tighten your stomach. This is not like a fitness class. This is a pre-run class. Engage your glutes. Go ahead, do some single leg marching in place. Do some pulses if you need to. Just get them to fire up a little bit more. Then from this position, kind of drop it down. This gives a nice lubricating effect to the sacroiliac joint. You see, when you run or move, it's so linear, you want to move with less energy. It's called running economy, and all this is going to lubricate those joints to make it easier for you to kind of move around. All right, let's get on our sides. Go ahead, fetal position, and just, open up like a book. Look, I'm stiff, I work out, but man, when I do these movements before I exercise, I am much more fluid. Then grab your knee and just pull it all the way back. This is not a stretch. This is to kind of wake up your body, get it prepped, get it ready to move around. You can't just go to yoga class and think like you're going to get flexible. You gotta prepare your body to move like that before you even start the fitness. Then go ahead, get into a side plank posture. Get your knees and thighs in line with your torso. Get a little athletic here. Get into a plank and then do a clamshell. If you take classes, I'm certain you've seen this, but you know what? I like it. It kind of wakes up the side chain. Everyone always talks about the posterior chain. That's like your hamstrings and glutes. I want the side chain to get opened up, and this will help get the glute medius active as well. I like repeating these movements on both sides. Let me just show you very quickly. I want you to open up like a book. Then I want you to grab your thigh, pull it to your chest, bring it back and forth a bunch of times. And then go ahead, get into a side plank. Get your knees in line with your torso. Plank up and just get the clamshell. Plank up and create tension into the glute medius. All right, let's keep going. Get onto all fours. And then I want you to flow with me. You're going to move up and down just to kind of get some tension release from your abdominal fascia into the iliac crest, iliotibial band. And then switch sides, back and forth. Just loosen it up a little bit. Then engage your spinal erectors. I mean, you're going to be running. Don't you want them to protect your back? And when you're rounded forward, when you're spinning, don't you want your spinal muscles to kind of have a little bit of engagement before you kind of lean forward so much for so long of a period of time? From this posture, kind of now get into your conventional cat-cows, kind of loosen up a little bit. And then gracefully stand up. Move your hips a little bit, get the sockets to move a little bit more lubricated. Now follow me on this. This is my favorite way to keep, we're still moving, we're not stretching, and we're not running yet. All right, get into like a nice warrior one. I'm not a yoga expert, but you get your pelvis to point forward, and that creates a lubrication effect to the iliac, or the iliacus. Remember, iliotibial band? So you kind of hold it, you kind of move a little bit. Then take your leg, get it out to the outer part of the mat, warrior two, and now squeeze your glute, and you're gonna get a great stretch to the front of the psoas and the iliacus, and then come forward, like you're shaking someone's hand. And then it really engages that area. And then get into like a forward lunge. And now we're hitting the top part of the quad as it attaches to the top of the ilium, iliotibial band. You see where I'm going here? Then come down and just twist. You want to twist the fascia so it makes you run more freely. You want to loosen up that core so when you are running, it kind of makes you move with like using less energy. Then follow me on this move here. You're going to take your back leg, turn it out. You're going to take your front foot, point it forward. And that creates tension and stretch and release to the ITBAND, Piriformis, glute medius over here, Quadratus Lumborum, and ITBAND on the opposite side. Whew! You want to see that again, I know you do. All right, follow me. You get into like a warrior pose, get the iliacus moving and kind of limber. Then foot out to the side, a little on an angle. Shake someone's hand. Squeeze your glute. That'll stretch out and release tension or adhesions into the psoas, iliopsoas. Then get into a forward lunge. And then squeeze the glute and get that tension released from the front of the quad. Then get your hands down and you want to twist that fascia around your torso. And then lift up and then twist it a little more. And that's going to make it so much easier for you to move and run. Then follow me on this. Hand down. Back foot, just turn it out. Don't you move it. Just turn it. Front foot, don't move your hip, just your foot. Woo! And that, man, that really releases tension on the IT band, glute medius, piriformis, quadratus lumborum, and IT band on the opposite side. Oh. All right. Now you want to stretch. Let's keep it simple. My kneecaps hurt, so I use like a cushion. Don't be shy. So, keeping it simple, just kind of kneel, get your foot down like this, flex it up, and don't round. That's terrible, terrible for your back. Just kind of hinge. Ooh, I feel it pulling right through the calf, popliteal fossa, hamstring, adductor. Now when we're stretching, because you're going to go for a run, I'm going to recommend one stretch, each one time for 10 seconds. So this is not a yoga class. This is like get my body ready to run class and prevent IT band syndrome. Then get into a lunge. And right away I feel like if I engage my glute and I squeeze it, it causes reciprocal inhibition. It releases tension to the front of my quad. And that quad attaches at the iliac crest. Then be graceful, grab your foot, and lean forward. Now for those people out there, when they do this and they're like, my leg gets cramps up, go ahead, stretch it out. That's because you're too tight. You can't just open the door and go for a run. You got to do stuff in order to prevent injury. Go back, get into a lunge, lean forward, squeeze your glute, get that stretch again, 10 seconds. Come back if you need to cheat. Grab your shin, flex your foot so you're not pointing it, you're flexing it. And that makes it more natural as a natural running cadence. Woo, and just lean in. Then if you can, transition. I'm tight, I'm normal. But I do these moves so I don't get injured. And then if you twist to the side and tilt a little bit, gives a great stretch to the front. 10 seconds, and then move on. All right, and then I would repeat that on the opposite side. So, let's pretend you went for a run. You come back. Take a bed, a couch, something with elevation, and go ahead, lay back on it, grab both your knees, and just pull it all the way down, just like this. And then now I want you to hold your stretches longer, maybe 15 seconds, and try to do like 3 of each one. And then keep your leg down, push your leg out, transition, and twist. And this will release a lot of tension again, that fascial twist of the torso. It connects the Quadratus Lumborum, which is a hip hiker, to the iliotibial band. Then, you're tired of me moaning and groaning? Look, we all have our issues. Go ahead, get into a lunge posture. Put your leg straight up, and now just hold it. Squeeze that glute again so you feel that stretch to the front of your hip and thigh. And then, like I said before, gracefully grab it and then get back into that lunge. And if you're one of those people where you grab it and you engage your hamstring and it cramps on you, just come out of the stretch, put it up on the bench or the table or whatever, and just hinge forward. Then hinge the opposite direction to kind of get through here. Adductors and hamstrings. So again, you get into a lunge. Then you grab your shin, flex your foot, try to get your thigh back on top of the elevation again. And just hold this stretch, just like that. All right, piriformis. There's a lot of ways to stretch a piriformis. So on the bench or your elevation, keep your knee at like a 90-degree angle. You know, if you kind of bring it in like this, that's like cheating. You're not really stretching. That's why people are like, oh, I stretch my piriformis, I don't really feel anything. Keep your foot and your knee at 90 or even like 120 angle, 120 degrees. Then, lean into that stretch and you will feel it moving. I'll show you the other direction. You take your leg, keep it at like a wide angle at the knee, push your other leg back so you're lunging, woo, and you will feel it pull on the side where it attaches to the knee and the shin, up the IT band, into the piriformis, into the sacrum in your back. Let's pretend you don't have that. You can lie on the floor. You can get to like a tabletop posture like this, or whatever you want to call it, and then cross your knee over your knee, grab each shin, woo, and just pull it in. And then I'll show you from a different angle, just to make sure you understand. Knee over your knee, grab your shins, and that will engage tension into the piriformis area bilaterally on each side. Or go ahead, knee over your ankle, bring your leg up, grab your shin, go through your thighs, and just pull it in again. And try to really push this out. So you're pushing this way and pulling this in. Trust me, that will stretch piriformis and all the other rotators and glute medius. Feels good. I'm just going to stay here for like another 2 seconds. All right. What about Quadratus Lumborum? The QL. The QL attaches your spine to your hip and pelvis. And when it's short, it kind of gives you like that short leg. And then you're running all crooked. And that's what makes the IT band get all cramped up as well. So your legs are wide. Arm is over. You could grab your wrist. Bring it up so you lift your rib cage. Step behind yourself. Breathe in and twist. Want to see that again? Legs are wide. Arms are up. Arm is over. Grab your wrist so you really lift your torso. Step that leg behind yourself. And then breathe in so it moves the diaphragm off the QL. And then twist. That's a great way to release tension from that spot. So, I always recommend props. So here is like a stretch band. The IT band attaches all the way down behind you, to the outer part of your calf and shin. It's underneath something called the peroneal muscles. So the peroneal muscles, they'll stick and adhere to the IT band. So you have to bring your leg over like this to get that stretch to the outer hamstring and also to the fibers of the IT band that attach to the peroneals. Can you see what I'm doing? Let me change the angle. Up and over. Woo! And that'll give a great stretch. Because the IT band overlies or lays over the hamstring and the quad, but it attaches right here. So this is just another great way to stretch out that spot. All right, prop number 2. So I already told you that strengthening with the side stepping is not great for you. There's so many different exercises you could do to strengthen the glutes and the glute medius. Go ahead. Take a stability ball. Tighten your core. lift up, pull it in, push up, and now you're really engaging the glutes and you're not putting any tension on the tensor fascia lata. That's the origin of the iliotibial band. You know, people say, wait, this is for your hamstrings. And I'm like, yeah, but it's the posterior chain. So if you want to strengthen your glute medius, go ahead and do this. And then if you're coordinated, go ahead and try to march in place while you're stabilizing on the ball. Just don't cramp up in your hamstrings. So that's one way. Another way is to simply go ahead, like you've seen in plenty of different fitness classes, just bridge up and just pulse. If you want to engage those glutes, this is a great way to kind of just until you're fatigued. That's number 2. However, most of the time, my patients come in with the ITBAND syndrome with different problems around their knee. And the vastus medialis is a muscle, a teardrop muscle, that attaches to the inner part of the kneecap. And when you run or when you spin, the leg is always bent. It's like never perfectly straight. So as a result, that vastus medialis, or the VMO, gets super weak because it only works in the last degrees of knee extension. That means that it's only active when you're locking your leg out straight. So, please hold. Take an ankle weight, put it around your ankle. Take a foam roller, put it underneath your knee. I'll move this out of the way so you can see. Here is the VMO. When you're through with your run, go ahead, flex your foot, and straighten the knee. And do this short arc extension probably 100 times. And yeah, 100. It'll take you probably a minute or a minute and a half. And when you come up, it's like you hold for a second and you drop it. You'll hold it for a second and you drop it. Think, you take, sorry, did we lose you? You take about 2,000 steps per mile on average. So I'm only asking for 100 of these in order to combat the IT band and the outer part of the quads. Then, a lot of people think, well, I could just lay on my side and I could do like a leg lift. And you can. But here's the deal. If I lay on my side and now I'm perfectly straight, if I'm doing leg lifts like this, I am engaging and tightening that IT band. It's called the tensor fascia lata, all the way in the front. And that's just making it worse. If you want to do this exercise, take your other leg, bring it up, take your top leg, bring it all the way back into extension, and then lift it up. And then you can feel how you're working the glute medius, not tightening the tensor fascia lata. Strengthening the glute, making your IT band worse. Are you following me on this? All right. So, there's another stretch that I forgot and I love. Well, I mostly hate it, but it works really well and I recommend it. Go ahead, take a chair, get on all fours, take your foot, place it as far back as you can to get your shin almost perpendicular. And then, get into this lunge. And then come back. And then try to perform a posterior tilt. Like take your pelvis, arch your back, and then flatten your back. And that will engage the top of the quad at the iliac crest. Remember we talked about that? And this is probably the best quad IT band release that you could do for yourself without using foam rollers. And just kind of hold this for about 30 seconds because we're post-run now. And then you release, okay? And you repeat on the opposite side. Now, what about using some kind of voodoo floss or rock floss. Have you guys ever done that? It's really good for the knee. What you do, and we're certified, all the doctors in my practice are certified in active release and Grassin, Rocktape, Rock Pod, Rock Floss, Rock everything. So go ahead. If you have a problem with your knee, keep it bent. Try to figure out if it hurts when you go in this direction, then you want to wrap the tape the other way. If it hurts this way, you want to wrap it this way. So for me, it hurts when I go it hurts when I come up, so I'm going to push it the opposite way. And what I mean is you take the band, you keep some decent tension, and you pull pretty strong. And you don't leave any gap. It's like putting an ace bandage around your leg. And what this does, it flosses the fascia to kind of release from the ITBAND as it surrounds your knee and your shin. And you don't have to be great at putting this on. I'm obviously okay at doing it. And at the end, just tuck it in. Nothing special. There we go. And now, you try to kind of bend forward and back a little bit, and it's kind of pulling the cellophane wrapper of fascia off of your muscles and off of the tendons that maybe are restricted in their motion. Then go ahead and try to straighten it, keep the weight off of it. Try to grab your leg, pull it up, pull it back. Maybe go ahead and do something functional, like a squat. Play around with it. But when you keep it on, about 90 seconds. That's all you need. Then, let's just get rid of this for a moment. You can see how the blood starts circulating back in this area. It works by releasing a perfusion of blood, and now, it's nice and loose now. I also recommend getting some cups. You don't have to be an acupuncturist to do it, though seeing an acupuncturist is probably a good idea. But this is for musculoskeletal. We're not talking about doing a meridian for energy and chi. We're talking about helping your knee. So these are called rock pods. Take it, turn it inside out, find an area. I recommend the top of the knee. And then you pull. That's one. Then let's get this up. It's hard to do it on yourself. It's easier when someone does it, but we're trying to teach you to manage when you're home. Go ahead, put the suction cup on. Then get another suction cup, put it right over your kneecap. Oh, it feels good. Then get another suction cup, put it on the ITBAND as it inserts to the side of your shin. That feels good too. And then let's see if I can get this stuff to stick a little bit more. That feels good. Get it on the side of your ITBAND. And now on top of the quad, right on top of where the quad inserts into the kneecap, that's called the articularis genu. And the articularis genu causes bursitis to the knee. Now, I don't know if you can see, but man, it's kind of pulling like this, like suction. And fascia gets compressed. You have skin, you got fat, then you got fascia, muscle, fascia, muscle, fascia, muscle. It's like a 7-layer cake. And just, it's getting squished. And what these do is it kind of pulls it, and then you can move them or move your leg around. That feels kind of nice. And it's like a self-treatment of kind of releasing tension to the fascia. So you can push it forward and back and forth. Find the areas, like if it hurts one way, feels good the other. Go into the area where it hurts, because that's going to kind of you have to desensitize it. And then, even with these, don't keep them on longer than 90 seconds. Because these marks, you've seen the people walking around with like what looks like octopus marks on their legs or their arms or whatever. It's like, you don't need it. You just keep it on 90 seconds. This one actually feels pretty good on my kneecap, so I'm just going to keep it there a little bit longer. Move it around, stretch it, and then, release it. Look, I'm Dr. Duke, and I'm glad that you listened to my presentation. And if you need any kind of telehealth, go ahead, call my office.